My study was looking at a regimen called modified hyper-CVAD with the addition of an agent called bortezomib, and the name of that regimen is called VcR-CVAD. And this regimen was developed based on our interest in developing a somewhat intermediate intensity therapy for mantle cell lymphoma. In the past, we knew that using other regimens that are usually used for lymphoma, like R-CHOP, don't result in very long remissions in mantle cell lymphoma. And so this was developed as kind of a medium intensity regimen that may improve outcomes for those patients.
Okay. And what are kind of the benefits of adding bortezomib to this then?
Well, previously there had been some studies with just the modified hyper-CVAD portion of the treatment, and those results looked much more promising than with more standard dosing of regimens such as R-CHOP. We saw very impressive long-term survivals with this regimen called VcR-CVAD, and it's really unclear if that's related to this drug called bortezomib that was added, or if it was related primarily to the longer course of maintenance therapy that was given after chemotherapy.
Is there any plans to find out which of the two would be more responsible then? Because it seems like investigating just the one at a time would be it'd be slower, but it might give you more clarity.
Right. That is an interesting question, and I think that if mantle cell lymphoma particularly was a more common lymphoma and it was easier to do these larger studies, that would be a very interesting and helpful question.
I don't suppose you know any of the results, like the statistics, percentages off the top of your head that we might have?
Sure. So the thing that was very interesting about this study was that we followed patients for about 8 years, and at the end of that 8 years, half of patients who were enrolled remained in remission after receiving this VcR-CVAD chemotherapy. And for mantle cell lymphoma, that is pretty remarkable. That is actually on par with some studies of patients who got very intensive regimens, including things like autologous transplant or another more intensive regimen called R-hyper-CVAD chemotherapy.
Well, you mentioned that mantle cell is quite rare. Is there a standard of treatment existing, and would this be a step towards one?
So, mantle cell lymphoma is a rare type of lymphoma. There is no single standard therapy for mantle cell lymphoma. At the time that this study was developed, it was the early 2000s actually. We accrued patients from 2005 to 2008. And treatment for mantle cell lymphoma has evolved quite a bit since that time. It has looked more at giving very intensive therapy to young patients and giving less intensive therapy to older patients with a drug called bendamustine. In addition, there's been new targeted agents that have become available for treating mantle cell lymphoma that will probably get incorporated into chemotherapy. And so this particular regimen, VcR-CVAD, is interesting, and it's certainly available for probably a subset of patients who are not quite young and fit enough to receive intensive therapy, but not in the older category where you think they're not going to be able to tolerate anything that's even medium intensity. But I think the point of the study is it's kind of proof of principle that mantle cell lymphoma is a very, very heterogeneous disease, and that there are a subset of patients who will have very long remissions with these less intensive regimens.